The Senate Committee on Health, Education, Labor, and Pensions will come to order. This morning, we'll be considering 7 bipartisan bills and 1 nomination. We're going to debate each bill and then stack all the votes at the end. And let me start off by thanking each of the bill's sponsors for working on these important policies and to all the staff for working together to prepare these bills for our markup today. First bill that we will consider is S-3679, the Dr. Lorna Breen Healthcare Provider Protection Reauthorization Act, led by Senators Kaine and Young and co-sponsored by Senators Marshall and Murkowski. This legislation would reauthorize $45 million per year over the next 5 years so that healthcare workers in America can access the mental health services they desperately need. This legislation is named after a physician from Charlottesville, Virginia, who died by suicide while serving on the front lines of the pandemic in New York. Let me thank Senator Kaine for his leadership on this issue. Second bill is S-3765, the Emergency Medical Services for Children Reauthorization Act, led by Senators Casey and Budd and co-sponsored by Senators Smith and Collins. This bill will improve the health care that infants, children, and teenagers receive in emergency rooms around the country. It also helps to ensure the paramedics and first responders receive the training they need and that hospitals and ambulances have the equipment they need to treat pediatric emergencies. The third bill is S-4351, the Poison Control Centers Reauthorization Act, led by Senators Murray, Tuberville, Lujan, and Romney. This legislation provides funding for 55 poison control centers around the country that are open 24 hours a day, 365 days a year. It also provides federal funding for a national hotline, 1-800-222-1222, that the American people can call to get the help they need about a potential poison exposure from trained toxicologists, nurses, and other medical professionals. The fourth bill is S-3775, the Building Our Largest Dementia Infrastructure for Alzheimer's Reauthorization Act, led by Senators Collins and Cortez Masto, and co-sponsored by Senators Kaine, Murkowski, Lujan, Markey, Mullen, and Marshall. This legislation authorizes federal funding to help identify potential treatments and cures for Alzheimer's disease. It will help patients and family caregivers manage this terrible illness, and it will help older Americans to receive the early screening and protection they need. The fifth bill is S-4325, the Lifespan Respite Care Act, led by Senators Collins and Baldwin. This bill reauthorizes a grant program to support respite care for family caregivers at $10 million per year over 5 years. The sixth bill is S-3757, the Congenital Heart Futures Reauthorization Act, led by Senators Durbin and Young. This bill extends funding for the Centers for Disease Control to prevent premature death and disability and increase the quality of life for Americans with congenital heart disease, one of the most common birth defects in our country. The seventh bill is S-4045, the East Palestine Health Monitoring Act, led by Senators Vance, Brown, Casey, and Fetterman. This bill would authorize a study on the health impacts of the tragic train derailment last year in Ohio that devastated communities in both Ohio and Pennsylvania. As we all know, that train was carrying hazardous chemicals that were both spilled and burned, releasing those chemicals into the soil, surrounding waterways, and air. And we still don't know how this will impact the long-term health of the residents living in these communities. Finally, we will consider the nomination of Stephen Ravas to be Inspector General of the Corporation for National and Community Services, commonly referred to as AmeriCorps. Mr. Ravas has served in the AmeriCorps Inspector General's office since 2019. He started as counsel, then became Deputy Inspector General, and is currently serving as the Acting Inspector General. Prior to these roles, Mr. Ravas was an Associate Counsel at the Department of Homeland Security Office of Inspector General and a Senior Investigative Counsel at the Department of Commerce Office of Inspector General. Mr. Ravas is a well-qualified nominee, and I support his nomination. If we pass these 7 bills out of this committee today, we'll have reported out 29 bills so far in Congress, which is a pretty good record. Senator Cassidy.
Yeah. Thank you, Chair Sanders. The committee is reauthorizing today multiple expiring public health programs to help doctors, states, and communities better address Americans' health care needs. Our responsibility in this committee is to fully evaluate and improve programs so they work properly for those served and effectively use tax dollars. Congress can continue to fund expire programs, but failure to reauthorize misses an opportunity to improve. If a program doesn't work or meets its full potential, this is our opportunity to help it either get rid of it or help it work to its fullest potential. These have been achieved in a bipartisan manner, and I appreciate my colleagues working to complete this task, and I look forward to future bipartisan markups. Today, the committee examined Senators Young and Kane's Dr. Lorna Breen Healthcare Provider Protection Reauthorization Act, reauthorizing a program helping nurses, physicians, other healthcare workers access mental health and substance use services. And of course, this grew out of COVID, where Dr. Breen, so burned out, committed suicide. And this is just an example of the incredible strain and burnout healthcare professionals experience sometimes while providing life-saving care. I'm proud to say I helped lead the original legislation enacted in 2022. This reauthorization ensures continued access to needed care. Senator Budd and Casey's Emergency Medical Services for Children's Reauthorization Act of 2024 extends grant programs helping emergency medical services care for children. Obviously, children have different medical needs than adults, and providers must be equipped for these differences. The Poison Control Centers Reauthorization Act of 2024, led by Tuberville, Murray, Romney, and Lujan, reauthorizes the Poison Control Centers program. These programs support enhancement and improvement of poison control hotlines and other poison education and prevention services. For the best acronym of the day, the Building Our Largest Dementia, our BOLD infrastructure for Alzheimer's Reauthorization Act of 2024 extends programs improving education and detection of Alzheimer's and other types of dementia. And this effort and the award for the best acronym goes to Senators Collins, Cortez, Masto, Capito, and Kane. Senators Collins and Baldwin's Lifespan Respite Care Reauthorization Act of 2024 reauthorizes the Lifespan Respite Care Program. This helps communities provide a little bit of time off for family caregivers for disabled adults and children or those with complex conditions requiring full-time care, if you will, to allow for that family caregiver to have a little care for their own mental health. Senators Durbin and Young's Congenital Heart Futures Reauthorization Act of 2024 extends programs related to congenital heart disease, research, education, and surveillance, directing the HHS Secretary to convene a workshop to improve care for adults living with congenital heart disease. When children with congenital heart disease grow up, they oftentimes have trouble finding providers specializing in these conditions. We're not only reauthorizing, which is, by the way, the flip side of adults needing different care than the child. We not only are reauthorizing existing programs, but considering new legislation. The East Palestine Health Impact Monitoring Act of 2024, led by Senators Vance and Brown, directs HHS to examine potential health effects of the horrific train derailment in East Palestine, Ohio, last year by supporting a longitudinal study within the community. I thank Chair Sanders for today's markup and all my colleagues and their staffs for making this a successful collaboration. Thank you.
Thank you, Senator Cassidy. We'll now begin consideration of 7 bipartisan bills. For the awareness of all senators and staff, we intend to roll all votes until the end and hope to start voting as soon as possible. There will be 8 roll call votes total, and they should go quickly once we begin. I would also like to ask my colleagues to limit remarks to 2 minutes. We'll now consider S. 3679, the Dr. Lorna Breen Healthcare Provider Protection Reauthorization Act, and we have a manager's amendment. I move to adopt the manager's amendment in the nature of a substitute and have it be considered original text for the purpose of further amendment. All those in favor, please say aye. Aye. Those opposed, nay. The ayes have it, and the motion is agreed to. Are there any members who wish to speak to S. 3679?
Chair Sanders.
Senator Kane.
Mr. Chair, thank you so much to you and to Ranking Member Cassidy for including this bill in the markup today. And I want to thank Senators Young and Reed for leading on this legislation, but also many on this committee who have provided significant support, especially Senators Marshall, Baldwin, Murkowski, and Smith. This law was signed into law in March of 2022 with Lorna Breen's family in the White House with President Biden. The idea of this law is to work to reduce stress and burnout and behavioral health conditions for our frontline healthcare providers. They make countless sacrifices to care for us, and we owe it to them to make sure that they have the support they need to care for themselves and go the distance. The initial investment of this bill by Congress established an impact well-being campaign at the Centers of Disease Control and Prevention to educate leadership at hospitals, med schools, and health systems on evidence-based reforms to reduce burnout. And it also supported 44 grantees around the country, including 3 in Virginia, to directly implement tools to do this. Reauthorizing the bipartisan legislation will allow the work to continue, and I appreciate my colleagues' support. And finally, Chair Sanders, I have 14 letters of support from 71 organizations who have worked hard to urge passage of the legislation. I'd like to have those introduced into the record.
Without objection. Any other discussion?
I'll mention something.
Senator Cassidy?
I want to thank Senators Kane and Young for their leadership to reauthorize this. Again, as a physician, I understand just how much this burnout is real, as if we need further proof after Dr. Breen's suicide. I worked on the original legislation with Senators Young and Kane last Congress, and I again thank them. And I'm proud to support this bill promoting mental health of healthcare workforce.
Okay. Any other discussion? If not, we'll now consider S. 3765, Emergency Medical Services for Children Reauthorization Act of 2024. Are there any members who wish to speak to S. 3765?
Chairman, I do.
Who's that?
Bud.
Senator Budd, sorry.
Thank you, Chairman. 30 million children visit U.S. emergency departments every year. A child's health care needs are unique, and they require specialized treatment, equipment, and medication. That's why medical professionals need to be properly trained in this care. It's one of the things near me that the Children's Institute for Pediatric Trauma seeks to do. The Emergency Medical Services for Children program is the only federal program dedicated to improving emergency care for children. This is particularly important for rural communities. It's particularly personal to my family. Children and adolescents deserve the highest quality emergency care when they need it, no matter where they live. That's why I'm proud to co-lead a bill with my colleague from Pennsylvania, Senator Casey, also Senators Collin, Marshall, and others that have supported, to reauthorize the MSC through 2029 without any disruption.
Okay, thank you, Senator Budd. A further discussion?
Mr. Chairman.
Senator Casey?
Yeah, I want to reiterate what Senator Budd said. I'm so grateful for his work as we reauthorize the Emergency Medical Services for Children Act. And I've had the chance to work on the last 3 reauthorizations, and I'm grateful to be working with Senator Budd on this important priority. I wanted to make reference as well to legislation I'm supporting that relates to East Palestine, Ohio, and that what happened there with the Norfolk Southern derailment and the particular impact it had on Darlington, Pennsylvania. This derailment, as you might remember, in February of 2023, was a derailment that involved hazardous materials that caught fire, some of which were intentionally vented and set on fire, and the spill contents into streams in that area that affected the community. The legislation would establish a study on the potential public health and human health impacts of the derailment and subsequent chemical exposure. I think it's the least we can do for the people of Darlington, as we're concerned as well for the people of the state of Ohio. I want to make sure the people of Darlington, Pennsylvania have the benefit of that study so we can examine the health effects. Mr. Chairman, thanks for giving me the time.
Thank you, Senator Casey. Further discussion on S. 3765? Senator Cassidy?
Again, I thank Senators Budd and Casey for their work to reauthorize this. Think about children. They go all the way from a newborn all the way to someone technically who's 18 or 17 years old. There's a huge difference between that, and that is not even going to the differences between that person and an adult. That said, there are these physiological differences. This allows hospitals and first responders to be better prepared to account for those differences. This is one of the only federal programs dedicated to making sure that there's high-quality emergency care for children. And so I'm proud to support the reauthorization.
Thank you, Senator Cassidy. We'll now go and consider S 4351, the Poison Control Centers Reauthorization Act of 2024. Are there any members who wish to speak on S 4351? Senator Murray.
Thank you, Chair Sanders. I am really proud to have led reauthorization of the Poison Control Centers Network since 2003, and I look forward to voting our latest reauthorization bill out of committee today. As I always say, our poison control centers are a literal lifeline for families. They operate 24/7, and that's a good thing because on average they receive an exposure case every 15 seconds. That is 2 calls since I just started speaking today. In 2022, our 55 poison control centers nationwide advised on over 2 million exposures. So whether people are talking about an exposure from cleaning supplies or pesticides or snake bites or opioids, which poison control centers have been on the front lines of responding to, the experts at our nation's poison centers are always ready to help worried parents and patients and healthcare providers get the information and resources they need in an emergency. So as I think any parent would tell you, that truly is invaluable. It is hard to overstate how terrifying it can be to think your kid may have been exposed to a dangerous poison, or what a relief it is to know there's someone you can turn to at any time to get help. I'm glad that once again we were able to work in a bipartisan way to put together a bill to reauthorize the Poison Control Centers Network and continue this life-saving work. So I really want to thank all of my colleagues who've worked with me on this legislation. I hope everyone will join us in voting to move this bill out of committee today.
Thank you, Senator Murray.
Mr. Chairman.
Further discussion?
Mr. Chairman.
Senator Butler.
Chairman Sanders, Ranking Member Cassidy, thank you for including this life-saving legislation in today's markup. I'm happy to introduce this bill with Senator Murray. S 4351 is the Poison Control Centers Reauthorization Act. This bill reauthorizes America's Poison Control Centers appropriations for 5 years through fiscal year 2029. There are 55 accredited U.S. poison centers in the United States serving all 50 states and territories. Poison centers, dedicated teams of nurses, pharmacists, and toxicologists work to safeguard Americans by providing 24/7, 365 coverage. Their mission is simple: deliver top-tier care, research, education, and advocacy to prevent poison-related harm, contain cost, and save lives. Poison Control Center data is uploaded into the National Poison Data System within 5 minutes of being entered, and local surveillance allows the identification of emerging public health threats. I'm particularly proud of the Alabama Poison Information Center at Children's Hospital of Alabama. It was the 14th center established in the United States, and they have also developed the nation's first comprehensive snakebite program, included a post-discharge snakebite clinic. The Alabama Poison Control Center handled over 107,000 calls last year. Not only do these centers save lives, but they also save the healthcare system tons of money. Of the incoming calls to the Alabama Center, 85% of those were able to be monitored in the home, meaning those folks did not have to visit the ER. I couldn't be more proud of our center in Alabama and the other poison control centers across the country. I'm pleased to be able to lead this reauthorization with Senator Murray, Romney, and Lujan, and I look forward to the bill's passage. Thank you, Mr. Chairman.
Thank you, Senator Tuberville. Further discussion? Senator Cassidy?
I also thank Senators Tuberville, Romney, co-leads Murray, and Lujan for their work to reauthorize. And just to say in kind of a technical way, the Poison Control Center Network runs the Poison Control National Toll-Free Hotline and 55 poison control centers nationwide. I was in medical school about 40 years ago, and a guy named David Jewell, one of my classmates, would moonlight, if you will, take an extra job. And he would come and tell us the next day about a parent whose child had taken something, and he was able to just whisk that kid to the ER right away, or to no, don't worry about it, your child's okay. And that kind of personal note, just kind of a routine day for these folks, is not routine for the parent. What is just one more for David Jewell or any other worker is 100% for that parent. And what Senator Tuberville just now commented on, now that's uploaded within 5 minutes. We've made a lot of progress in 40 years. So this will reauthorize, this will continue that progress, that will continue to bring that relief to that mother, to that father.
Thank you, Senator Cassidy. Further discussion? Okay. We'll now consider S 3775, Building Our Largest Dementia Infrastructure for Alzheimer's Reauthorization Act of 2024, and we have a manager's amendment. I move to adopt the manager's amendment in the nature of a substitute and have it be considered original text for the purpose of further amendment. All those in favor, please say aye. Aye. All those opposed, say no. The ayes have it, and the motion is agreed to. Are there any members who wish to speak on S. 3775?
Mr. Chairman.
Senator Collins.
Thank you, Mr. Chairman. And my thanks to you and Ranking Member Cassidy for including the BOLD Act in today's markup. I was proud to co-author, along with Senators Kane, Capito, and Cortez Masto, the original BOLD Act in 2018. This law has led to the creation of a public health infrastructure across our country to combat Alzheimer's disease. Through BOLD, for the first time, we put real resources behind the interventions that can help improve the health and quality of life for people living with Alzheimer's and their caregivers, as well as to reduce the costs associated with this disease. Since enactment of the BOLD Act, the CDC has made 66 awards to 45 state, local, and tribal health departments and supported 3 CDC Centers of Excellence, each of which focuses on a key issue related to dementia, from risk reduction to early detection to caregiving. Reauthorizing the BOLD Act will allow this work to continue. Our bill is co-sponsored by 30 senators, including many members of this committee: Murkowski, Lujan, Markey, Mullen, Marshall, Baldwin, and Smith. It would reauthorize this programming through the year 2029, clarify the CDC's role in carrying out programming in order to improve program efficiency, and add an emphasis on translating insights from research into real-world applications. Let me thank the Alzheimer's Association, the Alzheimer's Impact Movement, and Us Against Alzheimer's for their continued partnership and support of this bill. Thank you, Mr. Chairman.
Thank you. Further discussion?
Mr. Chair.
Senator Kane.
I just want to add my thanks to Senator Collins and the other co-sponsors. It was a pleasure to work on the original version of this bill in 2018. It's done an awful lot of good, and I think I'm like everyone on this committee with direct connection to Alzheimer's, and the build-out of this public health infrastructure to tackle the challenge is a very laudatory and very bipartisan priority, and I'm glad that this is going to be marked up today, so thank you.
Further discussion? Senator Cassidy.
I thank Senator Collins as well as Cortez Masto and Kane for their efforts. And Senator Collins, she is just, since I've come here, has been the kind of most, boy, let's boldly go after this in terms of addressing needs for the Alzheimer's community. And if you think about Alzheimer's, it's the etiology, it's the treatment, and the management. And this is along the lines of the management. 40 years ago, I mentioned I was in med school at LSU. And I remember reading an article then 60 years old, that the challenges before healthcare are how do we address cancer, tuberculosis, and syphilis. We've addressed TB and syphilis. We've done a lot of things on cancer. And I think somebody in the future will look back and say, how do you address Alzheimer's? And I wish that we have the same victory on Alzheimer's as we have with syphilis, tuberculosis, and almost cancer. But I don't want it to be 60 years. I want it to be 10, and this bill helps make it 10. So with that, I, of course, strongly support this.
Thank you.
Further discussion? Okay, let's move on to S4325, the Lifespan Respite Care Reauthorization Act of 2024. Any members who wish to speak on S4325?
Mr. Chairman.
Senator Collins.
Thank you, Mr. Chairman, and let me thank you and the ranking member once again for including this bill in today's markup. I also want to thank Senator Baldwin for co-leading this important legislation to support our family caregivers once again. Every day, an estimated 53 million family caregivers attend to loved ones all across all age groups, disabilities, and chronic conditions. Caregivers help their loved ones remain at home, often delaying the need for expensive long-term care. This compassionate task, however, can take a toll both mentally and physically. I saw this in my own family where my mother took care of my father, who was suffering from Alzheimer's disease, for 8 years until he went into the veterans home in our hometown of Caribou. Respite care was really non-existent for her, other than that provided by family members. It is essential for caregivers as it helps to reduce mental stress and physical health issues that they themselves may experience. Our bipartisan bill would continue competitive grants to states to establish or enhance statewide respite resources and help ensure that quality respite is available and accessible to family caregivers. In addition to reauthorizing program through the fiscal year 2029, the Lifespan Respite Care Act would also clarify eligibility for individuals under age 18. It's remarkable how many young people drop out of school to take care of a suffering parent or grandparent. I encourage my colleagues to support this bill, and I thank the National Respite Association Coalition, the Autism Society of America, the Alzheimer's Association, AARP, which wrote a very strong letter, and the American Association for Caregiving Youth for their endorsements. Thank you.
Thank you. Further discussion on S 4325. Senator Cassidy?
I thank Senators Collins and Senator Baldwin for their leadership. I just met with a friend from high school who has cared for the last 40 years for a completely disabled child, and she was just exhausted at times, wanted to give up. This is the sort of program that would help her and ultimately help the person being cared for. So I thank Senator Collins for this, and I strongly support.
Further discussion? Seeing none, we're going to move on to S 3757, the Congenital Heart Futures Reauthorization Act of 2024, and we have a manager's amendment. I move to adopt the manager's amendment in the nature of a substitute and have it be considered original text for the purpose of further amendment. All those in favor, please say aye. Aye. Those opposed, nay. The ayes have it, and the motion is agreed to. Are there any members who wish to speak on S 3757? I do not see any. In that case, that concludes consideration of S 3757. We're going to move on now to S 4045, the East Palestine Health Impact Monitoring Act of 2024, and we have a manager's amendment. I move to adopt the manager's amendment in the nature of a substitute and have it be considered original text for the purpose of further amendment. All those in favor, please say aye. Aye. Those opposed, please say no. The ayes have it, and the motion is agreed to. Are there any members who wish to speak on S 4045? I do not see any. That concludes consideration of S 4045. All right. Good news is we've got a lot of people here and we can move. And I note the presence of a quorum and will now move to votes. The first vote is on final passage of S 3679 as amended. I move to favorably report S 3679 as amended. The clerk will call the roll.
Senator Murray. Aye. Senator Casey.
Aye by proxy.
Senator Baldwin. Aye. Senator Murphy.
Aye by proxy.
Senator Kane. Aye. Senator Hassan.
Aye by proxy.
Senator Smith. Aye. Senator Lujan. Aye. Senator Hickenlooper. Aye. Senator Markey. Aye. Senator Cassidy. Aye. Senator Paul. No. Senator Collins.
Aye.
Senator Murkowski.
Aye.
Senator Braun.
No.
Senator Marshall. Aye. Senator Romney. Senator Tuberville.
Aye.
Senator Mullen.
Aye.
Senator Budd.
All by proxy, by the way.
Chair Sanders?
Yes.
19-2. I have 19 ayes, 2 nays.
The ayes have it. The next vote is on final passage of S 3765. I move to favorably report S 3765. The clerk will call the roll.
Senator Murray? Senator Casey?
Aye by proxy.
Senator Baldwin? Senator Murphy?
Aye by proxy.
Senator Kane? Senator Hassan?
Aye by proxy.
Senator Smith? Senator Lujan? Senator Hickenlooper? Senator Markey? Senator Cassidy?
Aye.
Senator Paul?
No by proxy.
Senator Collins?
Yes by proxy. Oh, I'm sorry, Collins.
I am here. Aye.
Senator Murkowski?
Aye by proxy.
Senator Braun?
No by proxy.
Senator Marshall? Senator Romney?
Aye by proxy.
Senator Tuberville?
Aye by proxy.
Senator Mullen?
Aye by proxy.
Senator Budd? Chair Sanders?
Yes.
I have 19 ayes, 2 nays.
The ayes have it. The bill is agreed to and will be favorably reported. The next vote is on final passage of S 4351. I move to favorably report S 4351. The clerk will call the roll.
Senator Murray?
Aye.
Senator Casey?
Aye by proxy.
Senator Baldwin? Senator Murphy?
Aye by proxy.
Senator Kane? Senator Hassan?
Aye by proxy.
Senator Smith? Senator Lujan? Senator Hickenlooper? Senator Markey? Senator Cassidy? Senator Paul?
Aye by proxy.
Senator Collins? Senator Murkowski?
Aye by proxy.
Senator Braun?
Yes by proxy.
Senator Marshall? Senator Romney?
Yes by proxy.
Senator Tuberville?
Yes by proxy.
Senator Mullen?
Yes by proxy.
Senator Budd? Chair Sanders?
Yep. Yes.
I have 21 ayes, 0 nays.
And Mr. Chair, could I be recorded as an aye, please?
In person as opposed to in proxy. Okay. The ayes have it. The bill is agreed to and will be favorably reported. Next vote is on final passage of S 3775 as amendment. I move to favorably report S 3775 as amendment. The clerk will call the roll.
Senator Murray?
Aye.
Senator Casey?
Aye by proxy.
Senator Baldwin? Senator Murphy?
Aye by proxy.
Senator Kane? Senator Hassan? Senator Smith? Senator Lujan? Senator Hickenlooper? Senator Markey? Senator Cassidy? Senator Paul?
No by proxy.
Senator Collins? Senator Murkowski?
Aye by proxy.
Senator Braun?
No by proxy.
Senator Marshall? Senator Romney?
Aye by proxy.
Senator Tuberville?
Aye by proxy.
Senator Mullen?
Aye by proxy.
Senator Budd? Chair Sanders?
Yes.
I have 19 ayes, 2 nays.
The ayes have it. The bill is agreed to and will be favorably reported as amended. Now we're going to vote on final passage of S 4325. I move to favorably report S 4325. The clerk will call the roll.
Senator Murray? Senator Casey?
Aye by proxy.
Senator Baldwin? Senator Murphy?
Aye by proxy.
Senator Kane? Senator Hassan? Senator Smith? Senator Lujan? Senator Hickenlooper? Senator Markey? Senator Cassidy? Senator Paul?
No by proxy.
Senator Collins? Senator Murkowski?
Aye by proxy.
Senator Braun?
No by proxy.
Senator Marshall? Senator Romney,
Aye by proxy.
Senator Tuberville,
Aye by proxy.
Senator Mullen,
Aye by proxy.
Senator Budd, Chair Sanders.
Yes.
I have 19 ayes, 2 nays.
The ayes have it. The bill is agreed to and will be favorably reported. The next vote is on final passage of S. 3757 as amended. I move to favorably report S. 3757 as amended. The clerk will call the roll.
Senator Murray. Senator Casey.
Aye by proxy.
Senator Baldwin. Senator Murphy.
Aye by proxy.
Senator Kane. Senator Hassan. Senator Smith. Senator Lujan. Senator Hickenlooper. Senator Markey. Senator Cassidy. Senator Paul.
No by proxy.
Senator Collins. Senator Murkowski.
Yes by proxy.
Senator Braun.
No by proxy.
Senator Marshall. Senator Romney.
Aye by proxy.
Senator Tuberville.
Aye by proxy.
Senator Mullen.
That would be an aye by proxy.
Senator Budd. Chair Sanders.
Yes.
I have 19 ayes, 2 nays.
The ayes have it. The bill is agreed to and will be favorably reported as amended. The next vote is on final passage of S. 4045 as amended. I move to favorably report S. 4045 as amended. The clerk will call the roll.
Senator Murray.
Aye.
Senator Casey.
Aye by proxy.
Senator Baldwin.
Aye.
Senator Murphy.
Aye by proxy.
Senator Kane. Senator Hassan. Senator Smith. Senator Lujan. Senator Hickenlooper. Senator Markey. Senator Cassidy.
Aye.
Senator Paul.
No by proxy.
Senator Collins. Senator Murkowski.
Yes by proxy.
Senator Braun.
No by proxy.
Senator Marshall.
Yes by, I'm sorry.
Senator Romney.
Yes by proxy.
Senator Tuberville.
Yes by proxy.
Senator Mullen.
Yes by proxy.
Senator Budd. Chair Sanders.
Yes.
I have 19 ayes, 2 nays.
The ayes have it. The bill is agreed to and will be favorably reported as amended. The next order of business is the nomination of Stephen Ravas. I move to favorably report the nomination of Stephen Ravas to be Inspector General of the Corporation for National and Community Services. The clerk will call the roll.
Senator Murray.
Aye.
Senator Casey.
Aye by proxy.
Senator Baldwin. Senator Murphy.
Aye by proxy.
Senator Kane. Senator Hassan. Senator Smith. Senator Lujan. Senator Hickenlooper. Senator Markey. Senator Cassidy.
Aye.
Senator Paul.
Aye by proxy.
Senator Collins.
Aye.
Senator Murkowski.
Yes by proxy.
Senator Braun.
Yes by proxy.
I'm sorry.
Yes by proxy.
Senator Marshall.
Yes.
Senator Romney.
Yes by proxy.
Senator Tuberville.
Yes by proxy.
Senator Mullen.
Yes by proxy.
Senator Budd. Chair Sanders.
Yes.
I have 21 ayes, 0 nays.
The ayes have it. The nomination is agreed to and will be favorably reported. I now move to authorize staff to make any required technical and conforming changes when preparing S. 3679, S. 3765, S. 4351, S. 3775, S. 4325, S. 3757, and S. 4045. All those in favor, please say aye.
Aye.
Those opposed, no. The ayes have it, and the motion is agreed to. And that concludes the votes and our business for today. Thank
Mr. Chair,
Yes.
I just would like to be recorded in person as an aye on S 3679 and S 3765. Thank you.
Without objection. Thank you, everyone, for being here, and the committee stands adjourned.